So here we are at week 14 of Dr. Paul's protocol. This week's focus is on sleep and the importance of not just sleep duration, but also sleep quality. Individuals that have a reduction in sleep duration and quality are at much greater risk for psychological, mental, and physical health problems. Much greater. So there was a recent study that just came out in the journal Sleep Medicine, and the researchers showed very convincingly that young children that are seeking mental disorder treatment are prescribed sleep medications at a much higher rate than most young children, much higher. So there's a direct correlation between children who are seeking mental health treatment in general and the prescription of sleep medication. We know that the same holds true for adults, that oftentimes adults presenting with a psychological mood state disorder are often prescribed much higher levels of sleep medication than the average person, the normal population. Now the same holds true for physical health. We know that young children and adults who have lower sleep duration and quality are at much greater risk for metabolic syndrome. Specifically, they're at much greater risk for obesity, abdominal obesity. So if you deprive your sleep as both a child and as an adult, you increase your rate for obesity. And then the whole host of other health conditions that come along with that obesity. So be aware of that. Don't let your sleep get compromised. So I want to talk to you today about some strategies that you can put right into place today and the rest of the length of the protocol and for the rest of your life that's going to improve your sleep duration and quality to reduce your risk for mental health, psychological, and physical disease. There's no doubt that when you sleep, your brain gets rejuvenated. When you sleep, your body gets rejuvenated. And in fact, you're undergoing 4 different types of exercise. Those all need adequate recovery. And so it's not until you go to bed at night or take a nap during the day that you're allowing those muscles and all of those cells and things in your body to become recovered. Same holds true for your brain, that when you use those brain cells for mental work and emotions, they need downtime to recover. And if you deprive yourself of that, then your risk for psychological, mental, and physical disease sets in. So sleep is so important for every part of what makes you a fully functioning, healthy human. So let's talk about some of the things that you can do to help your sleep quality and duration. One right off the bat is the exercise that you do. Your 4 exercise routines that I'm having you do for Dr. Paul's protocol are wonderful to help increase your sleep duration because they're exhausting in some of them. Not all of them, but the functional training and the high intensity training are very stimulating to your body metabolism. So try not to perform those later on in the day, afternoon. I always tell people, you want to do your sprint interval training and your functional training preferably early on in the day so that you have time for your body state to become reduced and relaxed so that you won't have any trouble sleeping at night. The more stimulating and intense you do exercise later on in the day, the longer it takes for your body to unwind. However, when you do that endurance exercise bout, that is one of the most effective strategies you can do to help your sleep pattern because it's already putting your mood and your mind in a very happy, content mood state, which is very favorable to helping you sleep. Same holds true for the yoga. Particularly if you do the yoga and adapt it to make it a little bit more meditative and relaxing, that can be performed anytime during the day. Now for the nutrition, you want to try to limit your caffeine intake, and I'm not saying not to drink caffeine or take in caffeinated foods, but just do it before noontime. If you do later on in the day caffeine after noon, it is a stimulant, particularly of the central nervous system, your brain, and it's going to keep it active. And so it's not a favorable thing that you want to be doing for helping you sleep better. So try to take your caffeine before noontime during the day. Second, in terms of food, you want to make sure that you are limiting the intake of acid type of foods, spicy type foods, because it agitates, for many people, their gastrointestinal tract, and so it causes some acid reflux. So you don't want to eat those hot and spicy foods or acidic foods later on in the day. third, when it comes to food, I recommend that you do eat a light evening snack, but a very favorable one that's in the ratio of 2 to 1, 2 carbohydrate to 1 protein, preferably in a carbohydrate source like a grain, like a cereal or a bread, or some rice even, or a sweet potato, and then have a little bit of protein with it. That's going to be very satiating, and it's going to be very relaxing because of the other hormones that it releases into your bloodstream. So that's a very favorable type of food combination that you can eat just before bed. Not a lot, a couple hundred calories, if that, 100 to 200 calories. That's not a lot before you go to bed, maybe an hour or two before you go to bed. All right? Keeps you in a very favorable metabolic state, but also a very favorable hormonal state to help you sleep better. So that's the nutrition and that's the exercise to help your sleep pattern. Now moving into the physical environment of the room. This would not be a favorable environment because of the natural sunlight. You want to put yourself in a dark, cool room. Make the room as dark as possible. Make it as cool as you can, preferably 75 degrees Fahrenheit or less is a favorable sleep condition. And try to eliminate the electrical charge in the room. Try to take out any TV that you have in your bedroom, any alarm clocks or clocks in general that are run on electricity. Use battery powered if you can. Limit the static energy in the room as well. And that's really important. So even a rug, certain rugs have a very high electrical static charge. And so I would try to see if you could put your room with a hardwood floor. Is a much better sleeping environment. How much now is another part that I want to focus on. And for young children, obviously if they're a young baby, they should be sleeping the majority of the day to help them grow. Developing children up until the age of 6 to 8 years of age, of course, should be sleeping as much time as they're awake, so probably 12 hours is a good rule of thumb for a young child. As they move into adolescence, they can require still quite a bit, 10 to 11 hours of sleep. 10 would be probably an ideal. And then as they get into their teenage years, I would say they want to be sleeping again 9 to 10 hours a night. During those teenage years, they're still developing, they're still forming new body cells, as we are all the way through life, but really growth cells in their body. And then as you get into young adulthood, 20s, 30s, and 40s, you should be trying to stay as close as you can to 8 hours a night. Some people require more. I don't suggest that you take less than that. That's really important because of the other effects that I've mentioned previously. And then as we get into our late 40s and 50s, such as menopause for women, and male encountering the similar type of menopause, male menopause, sleep duration goes down a little bit. And so if you can try to get in 7 hours, that's going to be the ideal. I really encourage to try to get to that 7-hour minimum of sleep a night. Now I'm going to make one more suggestion in terms of sleep. If you have the ability to take a short nap during the day, do it. And there's evidence to show, scientific evidence to show that when you nap during the day, you have a much more healthy functioning of your cognition, your brain function, and your mood state, not to mention your physical energy. So there you have it. And if you can put yourself on a regular sleep pattern, getting up at the same time and going to bed at the same time, putting in those exercise and those nutritional strategies that I've given you, you're going to find your sleep quality enhancing. And your overall health as well. I'm yours in Optimal Health, Dr. Paul. See you soon.